Hey, Dr. Schaffner, how are you?
I'm fine, Austin. Good to be with you.
Thank you for coming out and being my first person that I get to interview on my channel. It's called Honestly Austin.
That's wonderful. Good. I'm glad you're doing this.
All right, so let's get started on the questions. So, first off, I know that you're an infectious disease doctor at Vanderbilt. Can you tell us more about what you do on a daily basis and how did you choose this field?
Well, I'll start at the beginning and say I chose the field, or maybe the field chose me, because when I was in medical school, of all the different specialties that we were exposed to, somehow infectious diseases just appealed to me. I was
Mhm.
very interested in infectious agents, outbreaks of disease. The past history of medicine has much to do with infectious diseases, and it just attracted me greatly. Also, it got me out of the medical center, out into the community, and I like that because that's where most infectious diseases start,
Yeah.
out in the community. And
Mhm.
then, of course, I was also attracted to the whole concept of prevention. I was intrigued with how vaccines can actually keep people healthy so that they don't need the attention of infectious disease specialists and when
Yeah.
they come to the hospital.
It's kind of
And that
crazy how one
appealed to
little
me
shot
greatly.
can cure it. It's kind of crazy how one little shot can just keep you from getting something.
Yeah, I mean, it's a remarkable part of science. Vaccines, along with clean water and the development of antibiotics, are thought to be the three great public health accomplishments of the 20th century, the last century. Of course, here we are in the 21st, and the rapid development of the COVID vaccine makes it evident that we're going to have even more vaccines going on into the future
Yeah.
that will prevent even more diseases and keep whole populations, including populations around the world, much, much healthier.
That's crazy. All right, so let's get into our first topic, or our main topic for the day, COVID-19. You probably talked about it a lot. So first off, when did you first hear about COVID, and did you think it would spread as quickly and extensively as it has?
Well, we all heard about COVID more or less about the same time, a year ago, and we heard about these outbreaks of an infectious disease in China. You know, most of us thought that's another form of influenza because periodically new influenza strains often start in Asia and then move around the world. But
Mhm.
it quickly became apparent that this was not influenza, it was COVID. And initially, we didn't think it would spread that quickly. There have been two other coronaviruses that have moved from animals to humans. One was called SARS, the other one was called MERS. We don't have to go into the details, but they spread very slowly. So we said, COVID, all right, it's probably like its two cousins, SARS and MERS. It will spread slowly. But we soon discovered, that was not the case.
Spreads
This
fast.
was a very contagious infection, spread very rapidly, and indeed could spread to people who would not develop symptoms at all, but they could spread the disease further. That made it of epidemic in indeed pandemic potential. A pandemic is just an epidemic that sweeps around the world.
hmm So obviously you haven't seen, is this like, can you compare this to HIV or Ebola, or is it kind of on its own little category?
Well, it's very different. It's more like influenza because it spreads more readily.
Mm,
Both HIV and Ebola require very close personal contact for transmission. This disease, COVID, can spread just if you and I are having a conversation a few feet apart, and under certain circumstances, it can actually spread even beyond 3 to 6 feet and infect people in the same room at some distance from a person. So it has a much greater capacity to spread. And in a few short months, with the assistance of air travel, human beings like to get on airplanes, this virus spread to every continent on the world
Hmm.
except Antarctica. And
Yep,
for all I know, it may be there now.
probably is. All right, so this is a video blog directed towards teens and young adults. What can we do to help prevent the coronavirus from spreading even more?
Well, younger people are less apt to get seriously ill. Teenagers start to look like young adults in their capacity to spread the disease, but still, they're less apt to get serious disease for sure than people who are older and people who have underlying illnesses. So, why should they be concerned? Well, there are a couple of reasons. The first is every once in a while, this virus has the capacity to hit somebody who's young and healthy and put them in the intensive care unit in a matter of 48 hours.
Hmm.
So you're not totally immune by any means. So there's a personal reason for you to be careful. The other is that you can become infected, not be ill, but become a dreaded spreader. You can give it to others, some of whom may get seriously ill in your family, neighbors, friends, etc.
Hmm.
So we ask everyone if they go out outside of their family bubble to wear the mask and do the social distancing and avoid groups. That's not easy. And then one other thing, down the road, the vaccines will become available probably toward the end of this summer for persons who are in teenage years and then working down the age scale.
Hmm.
When your turn comes up, roll up that sleeve and
Yep.
get vaccinated.
I'm gonna get it as soon as I can. All right, so let's actually go into the topic of vaccines. Do you think vaccines will turn this pandemic into a more minor illness?
I think vaccines are the way out of this dim place we're in. And I can see the light at the end of the proverbial tunnel
Mm.
because more and more people are getting vaccinated. Vaccines will protect a substantial and growing number of people to the point where the virus, even if it's very contagious, will have a hard time finding new people to infect because most of the people will have been protected by the use of the vaccine. But in order for such a contagious virus to have its spread inhibited, we'll have to have a very high proportion of the adult population vaccinated. How high? Well, the back of the envelope estimates are up around 80%. And frankly, we've never vaccinated 80% of the adult population with any vaccine yet. So we have a considerable way to go. Now, one other little thing. We've all heard that there was a main strain, a parent strain of this COVID virus. And now this virus can mutate, it can change, and there are variant strains. So far, the vaccine works pretty well against most of these variants. So we'll have to get people vaccinated as quickly as possible. But
Yeah.
we have to keep an eye on these variants developing to make sure that one of them isn't mutated so far off the track that we have to develop a new vaccine
Yeah.
against that variant also. But
Hmm.
that's down the road a little bit.
Yeah.
We're still in the we're still in the position of having to get everybody vaccinated right now.
Mm. So I know that there are two vaccines available right now, right? And then there's a third one that just got approved. Can you
That's right.
explain the differences and the similarities between these?
Well, there are now, as you say, one just got approved, so there are now three that are available, and that new one is now being delivered across the country and will start being used already.
Mm.
First of all, they these vaccines are all comparably effective. And they're designed to prevent serious disease. And by serious disease, I mean illness that's serious enough to get you hospitalized or maybe even into an intensive care unit. So they're all pretty much comparably effective against preventing that.
Mhm.
They use new technology. They use, as you remember from your science course, either the first two used mRNA, which is a small chemical that's like an instruction manual. It tells the body what to produce, what proteins to produce. The newest one, this J&J vaccine, actually inoculates you with some DNA. That's the step before that. Then your body creates the mRNA and you get the subsequent response. The first two, those mRNA vaccines, require 2 doses spread apart by 3 weeks or 4 weeks. The new one, the J&J vaccine, only requires 1 dose, one and done. We like that.
Mhm.
And the new one doesn't have to be kept. Hold on, there's a phone ringing.
You're good.
There we go. The, my wife is going to pick that up in a second.
You're good.
So the first two vaccines had to be kept cold. One of them very, very cold in a really deep freeze. But another great advantage of the new one, the J&J vaccine, is that it can be handled in a normal refrigerator, just the way we handle other vaccines. And that will make it easier to distribute the vaccine out to pharmacies and doctors' offices and will help us vaccinate more people more quickly.
Mhm. So these vaccines were developed pretty quickly, under 1 year, right? Because that's when we figured out about COVID. Given how quickly they were developed, should we as the public have concerns about any side effects from these vaccines?
That's a very common and very important question. First, let me change your thinking about that just a little bit. The science behind these vaccines has been understudy for 15 to 20 years. So that helped us a lot.
Mm.
Then, when this new problem, COVID, came along, yes, the scientists were able to create a new vaccine in a matter of months. But of course, they had all that backlog of 15 to 20 years worth of work that they could employ when the problem arose. Now, we have studied these vaccines intensively before they were granted approval by the Food and Drug Administration. We've cut no corners. They are very, very safe vaccines. And before they were released for general use, they were studied in very large populations, 15 to 20,000 people who were volunteers actually were studied. So we can be sure that they're safe.
Yeah. So, do you think we'll have to receive these vaccines yearly, like the flu shot?
That's also one of the most common questions. You know, we're not quite there yet. We're trying to get everybody vaccinated with the first dose.
Mhm.
But more seriously, it's possible. You know, the flu virus changes very readily. And that's why we have to update the vaccine each year and why we have to get newly vaccinated. Something similar might indeed happen to this COVID virus because we know it mutates. We know that there are already variant strains out there, and we may well have to adapt the vaccine on an annual basis so that every fall, for example, you roll up one sleeve and you get your flu shot, roll up the other sleeve and you get your COVID vaccine.
Yeah.
We're not there yet. But you asked if that were a possibility. Yeah, people are already starting to think maybe we'll have to do
I mean, that wouldn't be bad. I mean, a lot of people don't like shots, but I don't mind them.
that. Good for you.
Yep. So, have any states handled this pandemic particularly well? And if any have, what have they done differently from the others?
Well, let me step back a little bit from that and say one of the things, to my sadness, is that we as a country have not been a world leader in how to handle this vaccine, not the vaccine, the virus. we've not had a really national response. It was left largely to the states, and the states actually then had a whole kind of crazy quilt of responses. As you can imagine, if it's left up to the governors and the health department directors of the 50 states, you're going to have some variation. There were some countries, however, that handled it very well. Australia, New Zealand, Thailand, South Korea, they did a good job. And so, two principles there. One, the politicians actually stepped back and put the commissioners of health in the front. And they said, the commissioners of health will tell us what to do. And they took the politics out of it. That's a very smart move.
Mhm.
The other thing was, as a consequence, communications to the public were very clear, science based, very sustained, and the public was told, as we learn more, we'll tell you more, and we may have to change some ideas. But it always came from the public health leaders, not the politicians. And those two things, leave it to public health, let them be in the front, and clear, sustained communications. Those are the two big principles for dealing with an epidemic or a pandemic.
Mhm. Yeah, I mean, we people in the United States didn't really handle it that well. I mean, everyone didn't really know what was going on, kind of went crazy. All right, so should we all be wearing the N95 mask like doctors, nurses, surgeons, or are the traditional plastic disposable masks good?
Actually, the regular masks work remarkably well. Yes, the N95s are even better, but we're trained on how to put them on, and they fit so tightly that it actually makes breathing difficult. And I would be surprised that the vast majority of people would be comfortable wearing N95s appropriately put on and fitted, because it makes the work of breathing harder. We in healthcare have to get used to that ourselves. But regular masks work remarkably well in protecting the wearer and making sure that the wearer, if they happen to be infected, can't transmit the virus to others around them. The trick is to get everybody to wear them.
Mhm.
And that's where the emphasis should be, particularly as more people start to get vaccinated. People want to take the mask off. Hang in there. Yes, we're vaccinating more people, but we're still at a time where we're going to have to keep wearing the masks for a few more months. Maybe this summer we can start taking them off.
Mhm. So this is another thing I hear a lot. Do you think is it true that younger children don't really have a problem with the mask? Like,
Well, the younger you are, the more difficulty you can imagine children have. But school teachers tell us it's remarkable that if everybody's wearing the mask, most young children who go to grade school do pretty well wearing the mask. They get used to it. Children are flexible, they're adaptable. And so if everybody's doing it, well, they'll do it too. So that's become less of a problem than people first thought.
mm. So what is this herd immunity that we've been hearing about?
So here's the concept. If you have a very contagious virus, if the virus is in me, it needs to go to other people to reproduce and keep going. Well, if we could vaccinate a very substantial proportion of the population and protect them, then if the virus were in me, it would find it very difficult to find someone else to infect. And so the transmission of this virus would go down in the population. And you wouldn't actually have to vaccinate everyone, but you'd have to vaccinate a pretty high proportion of, in this case, the adults in the population in order to reduce the transmission of the virus. And as I said, the back of the envelope calculations estimate that you'd have to get about 80% of the population vaccinated before this virus really has a hard time getting from one person to another.
Mm. So we haven't seen our grandparents in over 1 year. Since they've been vaccinated, do you think it's safe to go visit them again? Or
This is certainly the question of the day. And I would say, actually, within a week, we think the CDC is going to present new guidelines. But here's what I would say in the interim. Older people who are vaccinated, if they want to get together for a dinner or a game of cards or something like that, they can do that, right? Because they're all vaccinated. The trick comes in if you who are unvaccinated want to visit your grandparents. And there, I think the major issue is, who are you exactly? Have you been careful and safe for all this time? Are you good at wearing your masks and stuff? Because if you are, then you can reduce the risk in visiting your grandparents. But if you're out there being very cavalier and careless and carefree and haven't been wearing your mask and you've been around all your buddies, then I think you ought to be much more cautious. And that's because the vaccine, although it's very good, we say it's 95% effective. You know, I didn't say 100%.
mm,
And so we still have to be careful. And even now, I would say if unvaccinated people visit vaccinated people, maybe we ought to do social distancing and wear the mask, but at least we could spend some time together and see each other, yeah, and give each other a quick hug and kiss, and then separate again and spend an hour or two together. And that would be wonderful.
mm. All right. Well, thank you, Dr. Schaffner. That's all the questions I have to ask for you. Appreciate you coming out of your busy schedule and keep educating us on this COVID-19.
Well, Austin, it's a pleasure being with you. And remember, we're learning about COVID, new things every day. And if there comes a time when you'd like to do this again and we can do an update, you know
Mhm.
where to find me.
Yep.
In the meantime, stay safe.
You too.